I said, it's a statement of purpose as to why I've asked you to come. And that is, as we are members of the leadership team here in the city of Port Arthur, Texas, and we are committed to a unified response to this COVID-19 global pandemic. Now, we must pay special attention to protecting our vulnerable residents and dedicating our resources, our platforms, our political will, and even our professional authority to identifying and addressing the ways that this infection may exacerbate existing situations and circumstances within our community. Now, we are committed to setting the tone in this community of Port Arthur that will reject the spread and further infectious nature of this virus. Now, as leaders, we will work to ensure that this crisis does not exacerbate chronically ill residents or even those who find themselves in a state of health. Now, this moment that we have right now is an opportunity for us to better understand how we all are affected when some of us lack the protection of a safety net. We must commit to lifting up the medical and the social needs of the most marginalized members of our community, sharing examples of how centering their needs can ensure that we are all safe and healthy. And I respectfully submit this statement to you as a purpose for my asking you to gather here on this afternoon. Now, I have Roman numeral one right there, a slowdown versus a shutdown. Because, and I'm going to call Ms. Judy Smith, come on in. Thank you. She's going to be able to help me to even, she didn't know it, why we could have a slowdown in Port Arthur. And the slowdown would be because what has actually occurred, we don't have, Commissioner, an active case as of 1 o'clock today, right? Even in the whole Jefferson County, we're still blessed not to have an active case of COVID-19.
Yeah, that we know of. The testing has been slow, so we really hadn't gotten information. And have had people that travel outside.
Right, and on the call with the governor and the information, and I even got the email subsequent to the call, that Texas, I think we'd only done 272 tests in the whole week prior, am I correct? But in the next week, we're going to be able to do 272,000. So they are stepping up what's happening. And they're also going to, they took your idea, they're going to have drive-through testing facilities where persons can be tested if they think that they've been infected or exposed to it. And that's something that's going to be available within the next 2 or 3 days, from what I can understand. I'm not sure how you all going to access it. I'm just a politician here. Y'all are medical people, so y'all going to make it happen. But to have a slowdown, actually, maybe we all can't go as far as Dr. Renaud has gone, been in the field of education, all around the nation. And I had the privilege of being in Washington, D.C. for about 6.5 days, just returned last night, and have observed what is going on the Eastern Seaboard, observed how school districts, if you will, Dr. Puerto Rico, how universities, I know you all have seen it, you know, right now we're supposed to be caught up in the middle of March Madness. And now it's sort of like March Gladness because they don't have any games. We're just glad to be alive. Those are some of the things that we are actually dealing with and suffering with right now. So the slowdown versus the shutdown, if we are not prepared to totally shut down. Now, our health department, and I do have an area here where healthcare for precautionary measures in the city of Port Arthur. Can you tell us what we're doing there?
Okay. For For the city of Port Arthur, what the health department has recently had in place, even on yesterday, we held a meeting with some of our community healthcare providers so that we could get together and just be on the same page when it comes to prevention and how we could possibly slow down. We have literally used our city's webpage and our Facebook page to send out messages to our community. Basically what Texas Department of State Health Services and CDC requires, just telling them that the health department is consistently on every conference call at 4 o'clock listening to Dr. Hellerstadt and Commissioner David Gruber. Daily, getting the information, getting the updates, hearing the questions and the answers, and so we're posting as we get the information. We know that we have cases in Texas, and so, you know, we have actually utilized some of that even in the health department to help, like for the public that comes in and out of the health department, not necessarily to do physical screenings, but to do question screenings, like some of our long-term care facilities are doing, and even some of our other public places. Not necessarily getting temps on everybody, but asking those pertinent questions that most places are asking. In addition to putting things on our webpage, we really thought, because we do know, based on what we have seen on the website and what we have heard, that our elderly population are really the most vulnerable population. And so one of the things that we've done, we know that our elderly population may not be the ones who are going to frequent the city's webpage or look on the city's Facebook page. We actually sent out something in English, Spanish, and Vietnamese to all of our churches, because we know that's probably where most of them might congregate. And we did make the suggestion, based on what CDC is saying, that if you're 65 and older, and that age has changed, senior citizen has changed quite a bit in the last couple of weeks. First it was 60, then it's 65, and then I think Dr. Sanjay Gupta even said most of the morbidity and mortality was 70 and older. But we just used 65. If you're 65 and older, we just would encourage 65 and older or immunocompromised. If you had any kind of condition that caused you to be immunocompromised, that at this point you avoid mass gatherings. And so, you know, that's basically what we're doing now. We've had people call and ask questions. We are available for the questions. We have an answering service even for after hours, and so I know Ms. Simeon and myself have been taking calls even after hours, just to allay the fears that many of our residents have. People just don't know. People are asking a lot of questions about symptoms. They're asking a lot of questions about travel. And they're asking a lot of questions about the panic of people going out and just getting all of the supplies in the stores. So yesterday's meeting was actually to put us in tune with our long-term facilities, our nursing home, and our extended care facility, our hospital, our infection control, and emergency room staff were there, just so that we could be on one accord as to, like, if a patient came in or if a patient called and they were symptomatic and they fit into the criteria for being tested. So right now, that's basically what we're doing. Our health department right now do not have the availability to test, but we will. We will, and when we get the actual supplies, we will do the drive-through testing.
And when will that be?
We don't know. As soon as we get them,
That's
we will. Yeah, we don't know. We thought it was 2 weeks ago.
Yeah, right.
So we don't know. So we are, you know, when people are calling, and if they fit into that category, we are suggesting that they call their medical providers. And their medical providers can make that determination. Many of them are calling us to see if these are people that actually fit into the criteria. Mm-hmm. Because obviously everybody that wants a test really can't be tested. Yeah. And that's unfortunate, but everybody that wants a test can't be tested.
So
right now, it's just those people that fit into that criteria.
Director, what are some of the early signs? And I hear, you know, I think you're absolutely right when you talk about everyone can't be tested, and we know that. So what are some of the early signs? I was asking Mr. Alexander to kind of give some examples so the community could kind of be at ease a little bit about, because I'm getting the calls too, what should we do? You know, the Walmart's all packed, HEBs, they're buying toilet paper and cleaning supplies. You know, what is something that we can actually get out there to the community of Port Arthur and surrounding communities to, you know, suggest if that person needs to be tested? I don't know if the medical guys want to answer that.
Well, like most of your respiratory situations, you're looking at fevers, coughs, lower respiratory problems. When I say lower, I'm talking about the tightening of the chest, the pain in the chest. It's a difference from an upper respiratory problem and a lower. The lower portions of your lungs, where the gas exchange is taking place with all of us right now, will be exchanging oxygen from the atmosphere into our blood systems, is in a place of your lung that's called your alveoli. This is where your pneumonias grow, okay? That's where your viruses feed. It's in lower respiratory, not so much just the snotty nose or the sneezing, but it's the shortening of breath. That's a telltale sign of it. It's shortening of breath, because you're right at the level of gas exchange, and you're going to feel usually you'll feel some sensations there.
And I think most of the cases that we've read about may have started with fever.
You do that? Yeah. Okay. Well, and I'm just moving along so that I think everyone, if you have a question, the question can be answered. We have higher education with precautionary measures. Dr. Renaud from Lamar State College, Port Arthur. So, you know, I sort of introduced what you look at, everybody probably heard it, but maybe you can give us a little more information.
Yes, probably everybody has heard that we have, the campus will not have classes next week. We'll be open. Staff will be there, faculty will be there, but there will be no classes next week. We'll be using that time to try to move some of our courses to online instruction. And it's kind of a day-by-day thing right now. Probably by next Wednesday we'll have another update whether we're going to continue the cancellation of classes. But you know, absent good data from the CDC about how many people there are in the community that may have the virus, we tend to react. You take the most significant path that you can, and that's to keep students away from the campus. So, you know, we'll have an update again early next week and see what we're going to do. Most of the schools in the state are closed. Most of the schools have spring break this week, and so they are, of course, closed this week, and they're closing next week. Some of them are closing until mid-April. So, you know, everybody's taking a pretty significant path to minimize exposure.
Okay, thanks. Thank you, Dr. Renaud. Now we have the ISDs. We have the Port Arthur Independent School District represented, Dr. Porter. And what y'all changed in anything what we discussed this morning, or everything is still the same?
Everything's still the same. We want to thank Ms. Gita Smith. We are in communication with the health department, as we are with our Commissioner of Education and Region 5. We are talking with other districts as well to see what they're doing so we can all be on the same page. At this time, without having a confirmed case in Jefferson County, we will move forward with having school on Monday. In the event that something does occur, we will reevaluate as to where it has occurred and what we will do in order to try to mitigate some of the offset. We are cleaning. We are going to work with our students. We will have wipes that they can wipe off the computers once they complete it. We will work with our staff in order to do more cleaning. But at this time, it is best for us to have our kids together and working toward what they need to work toward, and that is learning.
Thank you. Okay, next we have in Sabine Pass.
We'll do the same. We will keep all of our kids safe. We'll do extra precautions and sanitary and so forth. The kids will be in school getting the education that they need at the time, because we know it's coming, so we need to get as much schooling as we can before it gets here. And so we'll take all of those measures. And we also are working with region and the health department.
Okay, Dr. Richardson, I believe you would be next.
Yes, thank you. As you all are aware, 2 weeks ago we did close stop instructions and we did sanitize because of an outbreak that we heard in another area. What we are planning now, we have a Sunday meeting with our safety staff, and we will be talking and planning how we're going to work toward getting our food in without it being contaminated on campus. So one thing we've done, we've purchased different covering for our designated staff who will be handling food from the trucks where what they come in on, so that the truck drivers will not come inside the school building, and we will sanitize all the food boxes and everything before it comes to our food service staff. And we're going to suspend school either Monday or Tuesday, depending on when the food truck come in. Also, we have a supply of water, because we don't let the students drink from the water fountains. We do buy the bottled waters in the large containers, and that has always been safe for us. Teachers will come in, staff will come in on Monday and re-sanitize everything, once again. So those are the things that we're doing in preparation, making sure that the food that's coming off the trucks are not contaminated. And designated staff with the right covering, they will sanitize all the boxes, so that's from milk to the frozen food that comes in from Labatt, and then they will, make sure that the food service staff, have that, and then we will, start school that Tuesday.
Okay. Now, Bob Hope was invited, Mr. Lopez, but he texted a few minutes ago and said he was unable to come. So that's why he's not here, but he was invited, and something had come up probably, and he couldn't be here to give us information as to what they are doing at his facility. Now,
I do want to say something. As I told the mayor this morning, I do have one employee that went to Europe. I talked to him about it. He wanted to go. What I have notified him is that you will not come to the campus, because he went to England, and we're not allowing him on the campus. He will be quarantined.
Yeah. Well, for 14 days, and that's what they're asking, the self-quarantine of individuals if you've gone outside the country. Excuse me, for those 14 days, and in the 14 days, if you don't show a sign, I believe that you're probably okay, right? So it's not asking, and if he loses funds, I'm going to get to something in a moment that we'll be able to discuss about that. Now, the next thing I have is food insecure zones, and I know this is something that's unique to us in the city of Port Arthur because of the socioeconomic involvement that we have, of demography that we have as far as socioeconomic levels go in Port Arthur, meaning that I think Dr. Porter, we over 80% or 90% of the students, just about all of them get a free lunch because the percentage is so high. I wish it would have been like when I was in school. I could be, twice. Like ought to be covered. Okay, but that didn't happen. Okay, you got to pay 25 cents or something, But we will have a concern about that, and I think I spoke about it with the commission. Had a great concern that if we have to close the schools down, some of those kids, and you all know this, that's the only time that they really have a full course meal or a nutritious meal is in the morning when they get there, and at lunchtime, and then they have the Columbia program. I forget that's what they called it when I was working for you. It's maybe a new name, but in the evening about 2 o'clock.
Champion program.
Champion, yeah. When the kids get something. Now, if we have to actually stop and close the schools down, those students are going to miss this. Now, that's why I checked on it to be sure. I want you to know that I'm researching things. I'm not just trying to have something and say, "Oh, Dr. Porter, you do this." I had your answer but you probably already known about it because folk who work in some other regions in the country told me about it, like Region 5. There's food insecure zones where they are setting up in either the school cafeterias or, well, and one lady even explained this morning, where the bus drivers are going to the bus stops with the prepared foods at breakfast and at lunch. And believe it or not, those students are getting up, receiving those breakfast trays in the morning at 6:30 or 7, and then they're back there at 10:30 or 11 o'clock to receive the lunch, because they know that they are, they're insecure as far as having proper amounts of food. So we would be covered with that if this does occur, and we would need to be sure that we cover those students. That's a vulnerable part of the population that we have. Now, another concern that I do have, along with that, is, and I have the gentleman from the port here, I have Mick from Sabine Passport and Port Authority, and Mr. Kelly from the Port of Port Arthur. And not that I'm going to call him Mr. Mick, sorry, I call it Larry's over. All right, anyway, all right, but I asked, I didn't actually get a chance to ask you, but I even mentioned it, Larry, that we have ships docking. And a resident brought this to me yesterday as I boarded the plane in Washington, D.C. through a text. Because I'm not that smart to think about all this stuff, y'all. Okay, but I have to have people like you all and other folks like a lot of our citizens who bring it to me, and I thank God I can comprehend, and I'm still at 65 duty, but I can remember it most of the time. Okay, and I remember that what we have is these individuals coming here from these different countries, because we want y'all to, have your port spaceman leasing it out to whomever. Putin, it doesn't matter to me, they got money. Okay, and that's going to, but it's going to eventually float down, to the city. So, what precautions are you all taking during this time? Because I want us all to be together on this, where if we're in a slowdown mode, for right now, and not a shutdown, but we're in a slowdown mode, what precautionary measures can we take, or are you all taking on those type issues? We call them seamen. I don't know what they call them now.
Well, we're not necessarily comparable to Port Arthur with us being a shallower port. We don't have international trade across our dock space. What we've done is just more internal communication for our employees, to take them about the precautionaries, be aware of what's going on, listen to the news, to be aware of themselves, for their families as well, and for our customers, more or less the same thing. Just an awareness, communicating. We've not changed any of our mode of operations at this time until we, like the school district, are saying, see more evidence of something more localized, and then we would have to change some mode of operation. But right now, we're operating as we normally have. We're just communicating internally with our employees and our customer base about taking the precautionary, be aware of what's going on, and keep in tune with the subject.
Okay.
And Mr. Mayor, same precautions, and I just add that there's an entire federal response that's been in place over 30 days that's been acting on this for quite some time. And so, if you think about it, these aren't cruise ships. These are working vessels, working crew members, 14, 15 people on board. They've been at sea for 30 days. So it's really not, that hasn't been an issue for us with any crew member in the waterway. But for us, it's not a big issue. There's other areas I think we have to focus on where there's a lot of people and the like.
So what I wanted this to be, the commissioner and I spoke about it, is to be sure that we have a workable plan, and we've thought about all of the different scenarios that maybe could occur. I know the media has been calling, and I think my health director, Ms. Julia Smith, because I've been putting these people on her for about 2 weeks. I just said call Ms. Smith, because I'm the mayor. I'm not the health person, and I speak with her. And when I spoke with her this morning, she was like, yeah, it's time for you to say something. Okay, and I appreciate the confidence that you would have in me to think that I would say the right thing, so I appreciate that. But with her help, because she's given me good information, and that is the greatest thing that I think that we could have. Spoke with, we have our assistant city manager here, Brother Scott Moore right here, who has come on board and has a wealth of knowledge, besides being a great finance person, but on managing the cities and then dealing with situations such as this. So I could only be a great mayor if I put great people around me. And I've been here for a long time. And that's what I say. I want to be a great mayor. I mean, I pray to God that I am. I'm striving to be. But the only way I can is I have to have the support and help of individuals like you. I know maybe this is something that's never been done before. You can rest assured, whenever something occurs that's going to have an effect upon our livelihood and our way of life in the city of Port Arthur, at some point I'm going to call you because you're a part of the leadership team here in the city of Port Arthur. Now, the last thing that I have here is about the Stafford Act, the implementation of the Stafford Act. I spoke with Representative Desatel, and he was one that I was trying to get on the phone also. If the president comes on in about another 30 minutes and declares a national emergency, Commissioner, which I know you're aware of, which he's probably going to do, because they won't tell you you get ready to talk in 30 minutes unless they already know, what he's going to talk about. Once this is declared, several things as we operate will basically change. One thing that we are assured of, and I was there in Washington, and I had a chance to talk with some individuals in D.C., Representative whoever, I was in his office. I talked with some other representatives and senators and other individuals who work on Capitol Hill. Like the Stafford Act, for instance, and this would begin, that act would come into place. There would be billions of dollars, and then on the call earlier today with Governor Abbott, that the money is going to trickle down to the state. Okay, Doc, we appreciate you. Okay. The money, and thank you, Dr.
Thank you for including me.
All right. That money is going to be available to assist cities and governmental entities or individuals who have suffered financial hardships because of the virus. Okay? And because of the virus, maybe you can't meet your payroll because everybody on your payroll is ill. Well, now, I can't say how the application is going to be, how long it's going to take them to, to fulfill it. All I know is that I have to believe in the government that I represent, okay? And that is that there will be money set aside, and it's really some billions of dollars that will be set aside to help individuals all over the country who've been adversely affected by this COVID-19. Now, with that in mind, we don't want just to make decisions based upon the fact that, well, we're going to get some money back. But if the city has to shut down, for an example, and we don't get any money, or even if your school system has to shut down, and TEH says you weren't there this number of days, so we're not going to pay you, there will be means and ways for you to recover that money. Now, the way that that's going to operate, do you know exactly how that's going to operate, Commissioner?
I think FEMA's going to handle this about $40 billion is what it's going to be. The FEMA's going to pretty much, if anybody that dealt with FEMA, you know,
right.
It could be 5-10 years.
Yeah, before you get it.
FEMA would manage that program.
Okay, and then even today, it's almost partisan, but it's real. The Democrats, with House Speaker Pelosi, whom I was in their company a few days ago, they had a bill that they've voted on, or they're fighting on it, or something right now that was going to deal with some trillions of dollars being sent down to communities like ours that maybe had to have some, or has rather, some type of financial burden because of the virus. Now, how the money will be dispersed, again, I don't think all those things have been worked out, because yesterday they were arguing about that, and friendly arguments on Capitol Hill about that. But I wanted us to be basically, like we said in church, on one accord on what's going on. I personally wanted to understand better why our school districts, and I told each of the persons that I spoke with this morning, I could not understand how we would be having school, I even told it to you, and all these other places around the country, but I based it on, and even they amended, I guess, we don't have an active case in Jefferson County. So I can understand them, and maybe if they would discontinue school totally, monies that would come down through this Stafford Act would not be allocated for them because there were no active cases here. So I thank God we don't have the cases kind of like Imelda. You know, I feel sorry for my Beaumont friends, but we didn't flood council. Okay, you know, so and those things happen. Now, what we want to be sure of is that as far as precaution goes, we are prepared. You know, we are ready. We have the healthcare professionals, Dr. Walks and Ms. McIntyre and his staff here in South County. He has them all up in North County right now, but I think it's with what the president is going to do. And I believe the county helps. And something with the governor at 3 o'clock, because he's making a call. Do y'all have to go be on that call? Because the one for us was earlier.
We have a 4 o'clock.
Oh, 4 o'clock. Okay, there's one at 3, but it's with the governor, and it may be just county health individuals with the 254 counties in Texas to be on a call with him for him to disseminate information to them about this. It's more serious, y'all, than we probably anticipated. We are blessed because we don't have any cases today, 13th of March. Who's to say by the 14th or by the 15th or the 16th what would happen? But you know, so prayerfully, being a Christian, I would say pray. You know, as you've been praying, and hopefully God will continue to spare us as he has done already. Now, if the inevitable happens, and we've got to make some decisions, I want us all to be, again, on one accord. I would really want us all to be together. I mean, Joe is here representing Pat Avery and the Chamber of Commerce. I couldn't invite every industrial member, you know, because the room was small, and then nothing has actually occurred. But we have thousands of workers coming in every day, driving into Port Arthur from various areas who could possibly bring in the virus. You know, whenever y'all we get the first one, I mean, God, I don't want it, but whenever that happens, I know you all have to go through the protocols to find out where, you know, and it could just be that this is a person who comes from that drives into Port Arthur every day. You see what I'm talking about? You know, our economy is based upon that type of mobility. And being based upon that type of mobility, it makes us susceptible to some things that maybe other communities such as ours would not be susceptible to. But I would say this: if we have a plan in place, again, I thank Ms. Smith for being vigilant. Dr. Walks and his staff for being vigilant. Each of you, our school districts, everybody, our business persons, our government leaders, for being individuals that care enough, and it's all what I said in here, and we care enough about the people that we serve. And I just thought it was necessary at this time to publicly, officially say something. And you know, it's good when your management administrators, you know, your higher ups tell you, yeah, it's like, so I appreciate you all, Scott. You know, so it had to be God because y'all didn't tell me no. You know, when I called him very early in the morning, called Shane, you know, he was like, Barry, I didn't know Shane get up that early though. He was getting ready to walk in his office at about 10 minutes to 7. You know.
It's been at 6:30, but you kept in the truck.
Yeah, okay, yeah, see. The only way I come in is like a hurricane.
Mayor, is pretty much, I think we need to take inventory of the grocery market, the retail business. Water is out, so I think every elected official as well as superintendent need to do an inventory on water. That's what everybody's panicking about right now.
Yeah.
We have some left over from Imelda, not to give out, maybe to the rural areas. But I think that's, if you go to HEB, and I did it had my secretaries do inventory, the water is out.
Even in Houston, man.
Yeah, so I think
I
you're
saw
gonna,
it last night.
if any request you can put in to the governor or anyone, I think it would be for, kind of like what we do for hurricanes, where they bring the water in.
Okay.
They have staging areas for water and maybe even ice.
Ice, yeah.
I think that's gonna be the most pertinent thing. That's what I'm getting calls about now. Where can they get water? I mean, luckily we had some left over that I might give out to the rural area. I can't provide it to the cities.
Yeah.
And I've already told my staff, so
Can't
anybody
just
that
use
have
water from the fountain?
connections to the water.
I think
that's what's gonna
they got a
be-
Okay,
panic. They
well-
don't have a filter on it. I
HEB,
think they may have
I
some
don't know about
concerns about
Albertsons and all
the
that.
filter.
And what you just said, I have a connection in the governor's office who will get directly to the
We
governor
need to get.
And I can-
It's
future-
airborne,
shoot them an email
You can transmit it air.
about that.
For the school
I will.
district, maybe the employees, I don't know. I
Yeah.
don't know how you do it.
Okay.
Any other concerns?
I think just,
Oh, go ahead.
oh, I'm sorry. So we've just confirmed that President Trump did declare a national emergency. Because of coronavirus, can we just circle back to?
He just did it? No, he did it 15 minutes before he said it, so. No, I got an email that said at 3 o'clock he was going to do it.
Okay. So
Yeah.
can we just circle back just so I have like the right information on what happens now in terms of how that's affected?
Okay, well, this is what, because I'm just kind of trickling down. I've spoken with Representative Dustin. I have Commissioner Senegal here. I've also spoken with County Judge Bragg. Now, he was going to be on the call, but we could never get the hookup straight. I will not make a decision or make some grand statement before I speak with the other persons who are in the hierarchy in our government around here. So I'm going, how you say, stay in my lane, and what we'll do is, as soon as all of the ramifications that are involved with this type of, I've only studied that because I went to college and studied government. Really to tell you how it's going to happen.
Mayor, could I get some clarification on how you plan to address the food insecurity if by any chance that the schools have to take off Monday or Tuesday or whatever the case may be?
I would get with the superintendents and just to be sure that they have, as the commissioner was just saying, a sufficient supply. Now, it's going to be incumbent upon them and their, what they call the food service departments, right, to have a sufficient supply, which I hope that they are doing now in case that occurs. You know, I don't know how
Let
you
me
all do.
answer that. We're in the process of purchasing more freezers because we will have 2 weeks, of additional food. So that's what we started that this morning, the purchase
Okay.
of additional freezers. So we will have food for our students. And if we do have to close, our students will have transportation already prepared so food will get to our students for breakfast and lunch. So that has already been, we've already taken care of that.
And just to clarify for Tacoma, did you say you're closing Monday or Tuesday?
We made Tuesday. We're waiting to see when the food truck will come in. Okay, so whenever we will send it out to our parents over our system and let them know what we're doing.
Okay, so Monday you do plan to be open?
Yes.
Okay, Tuesday.
Go ahead.
Just to answer your question, young lady, if President declared emergency, national emergency, what the next step in the city would be with the city manager, would meet the assistant city manager and our emergency management coordinator, which is John Owens. They would all meet along with the mayor. They would have a briefing, update. Then they'll call the council and from there we'll make decisions.
Thank you.
Along with probably along with the commissioners.
Well, Dr. Walker is the health authority for the county, so we'll lean on pretty much for this recommendation from the CDC and any information Judge Brand, he and Judge Brand and our emergency management. We probably have we do have an executive meeting planned for 1:30 Tuesday. Now that the president has enacted this emergency deal, I'm sure Jeff will be flying back in, and we may have one tomorrow. Who knows? I don't know.
And kind of clear one thing, what the mayor was saying. The mayor says there's no cases right now in Jefferson County, but going back to what the commissioner says, still testing is being done that we know of. No active cases that we know of. So we're a little cautious. I'm not saying we don't have any. We don't have any that we know of, but still testing. Commissioner, correct? the testing going on right now?
Yeah, well, no, it's no.
It's not even really a.
But we have to refer them to Harris County at this time anyway, so.
And one of the things for Port Arthur, just want to say this too, because there are a lot of rumors. still
Yeah.
Yeah,
going.
that's-
But if there is a confirmed case, a laboratory confirmed case for Port Arthur, it will be reported to the health department. The
Yeah.
health department will make a statement. It'll only come from the health
Department,
department.
right.
Only.
Correct.
So-
Yeah.
Great.
And this is who, if they have only 3 names that they will send the report to, and it's myself,
Yeah.
Ms. Simeon, the epidemiologist, and the assistant health director, Ms. Mayon.
Great,
So
great.
we will be-
Mayor, one of the things that our citizens, our businesses need to remember. Councilman, unfortunately, you are now an expert in emergency management.
Wow.
For everything
Yeah.
that we've gone through.
Yes.
Commissioner Senegal, unfortunately, we know FEMA very, very well.
Yes.
And so this city, this county, unfortunately, knows how to handle a
Yes.
disaster and emergency.
Yeah.
So we're in good hands.
And you know, great speech, Joe. Getting in front of this, I think this is what we need to get out to the media source. Like I said earlier, we getting the calls, the health department, the mayors, councilmen. What is the next step? What do we do? Now, since we've got this declaration from the president, you know, people, we're gonna get more calls on, we were in HB today, Walmart, and all the waters, like the commissioner said, was out of there, all the toilet paper, cleaning supplies. What do we tell the citizens here in Port Arthur now, since we've gotten this notification? So hopefully, he's right, we'll get with the city manager come in, and emergency management will come together along with all the departments, and we'll make decisions then.
At what point do we look at switching from a slowdown to a stop? Is it a certain number of confirmed cases? Is it 1?
You can take one, right?
Yeah, I would think it would be on the director of health here,
Yeah.
once we
And
get a
actually-
confirmed case.
Yeah, and it depends on where that case is.
Yeah.
If it's in a school, of course, then that becomes literally a shutdown. And that's still not the health department's call, that is the superintendent's call along with TEA.
Yeah.
We don't make that decision, we only confer with the superintendent about what our guidelines are.
And
or what the
and TEA did, the commissioner did put out a notice, and we posted yesterday. He's letting every local education agency decide whether or not make the decision on their own.
Now, sort of like, well, Councilman Jones let the cat out the bag, so to speak. If it actually occurs and it's already a federal emergency, the mayor in any city in the state of Texas then makes the call.
Under the staff of that.
Okay? I'm telling you the call I'm going to make for quarantine everybody in Port Arthur. Because I don't want to catch it. You don't want to catch it. And that's what it will be. And it will be based upon, once he tells me, the mayor, this is it. And this person was at a funeral, a bar mitzvah, a wedding, in a club. And I mean, I sound humorous, but it's real. All of those persons there, church, all of those individuals in there then become susceptible to it. Am I correct?
Okay, but here's the deal, let me just say this too, because I am a nurse first, okay? I'm not going to release enough information for the citizens to know who this person is.
Oh, yeah.
I know, I'm just saying. So, when we do surveillance, we're going to do surveillance on those persons. When Ms. Simeon or myself or Ms. Mayon talks to that individual and we get their information, where you've been, what you've done, where you've traveled, we're looking for that group first. So when that information comes out, we may just say it's travel related, or we may just say it was community spread. We're doing the inside work. The public is going to know what they need to know. Honestly, we will not hold anything back, but we're not going to be giving that much information where somebody will be able to, by the process of elimination, figure out who we're talking about. If they decide to tell, that's up to them, but it will not be on the health
I'm
department.
glad you cleared that up, because I think that sounds real harsh.
That's okay, I just wanted
And
to
the reason why I say it,
clarify
because as a training that I attended in Washington, D.C., once an individual goes into a facility where there are other individuals, and this person is contaminated, then he or she actually has the opportunity to it contaminate everybody that's there. You know, and then those individuals leave that particular location with the contamination. I mean, you're the epidemiologist. I mean, you can tell, but then they go somewhere with it, and then they spread it to a bunch of folks. From what I can understand, the way it began in Washington, there was a healthy person went to visit the nursing home and kill up all the old people. Well, that's what I like to say in the news. Okay, but I mean, that's what happened. A healthy person, am I correct? And I know they're real professional. I'm a politician. I don't want everybody to know. A healthy person had it, went there to visit their relative, left it there with all these people with these compromised immune systems, and when 24 of them died,
It's over 20.
yeah. You know, and those are the type of things that I would want to prevent. That's why I said what I said. I would want to prevent that from happening in our community, and being the emergency management voice, or as far as the law and the rules in the state of Texas go, because it would be declared that, I would do it based upon the information I get from them. But and as I said, I'm glad you said it's not. I'm gonna ask, you know, who the person is. No, you know, all they can tell you was that you go through that with that term you use when you all investigated.
And they're be assured that we will definitely, those people who need to be notified, we will definitely
notify those. Yeah,
we've dealt with TB patients, so we, you know what I'm saying. This is different.
Yeah,
we've dealt with TB patients in our city.
Yeah,
so we
and
know
they go and say, well, I
exactly.
with this person, I went over to dinner with this individual.
We know how to narrow that gap or expand it.
Right.
Whoever needs to be notified.
So, you know, we're on it. Yes, sir.
Oh, and you might have been humorous at this point, but when you say if you had to, you would quarantine everybody, does that mean just leave everybody at home? Because where could you have everybody quarantined elsewhere?
Well, if you looked at Italy, I don't know if they all hid in the bottom of the basement in the church or where, but a camera panned Italy before I left Washington, D.C., and there was no one on the streets, I mean, no one anywhere when they shut the city down there. Now that's international, but if we would have to do, I hope we wouldn't even have to, but I mean, Commissioner understands, and it wouldn't just be done with me saying, I don't want to, no. I mean, I talk with the Commissioner and with the county judge, with a council or something, this is what we're doing, so if something bad happens, I can, you know, I don't take the blame just for myself. Spread.
Real quick, man, I gotta go. It's pretty much we have in the sub courthouse place center those little things you spray in. So cleaning the courthouse and you know everywhere they touch handrails, we have a person that's going through the courthouse. All we can do is just try and prevent it, but we have those
sanitation stations.
Yeah,
we have about 30 or 40 of them all over the courthouse, but we hope people are utilizing
right
in the sub court.
Yeah,
and the judge, I think they have them in the courthouse in Beaumont. So pretty much, I think that's something that where the public frequents in the schools, people may utilize.
Well, we're just being proactive.
Not saying it's going to totally prevent it, but at least being proactive.
Okay, and it's being proactive on it. Well, it's been about an hour. I appreciate you. I don't want to coach one your time. Did you find out about this food out there? I don't know what. I don't know if the city manager, because he orders food from them, but the lady brought a bunch of food.
I'll talk to you about that.
Oh, okay, so that's not for us. Oh, that's, okay, no, you know how he does this.
Yeah, no.
And I'm like, I know I didn't discuss that.
No, I got that.
Oh, okay, and she just was putting it in there.
Yeah,
okay.
I'll tell you about that.
Okay, so I appreciate you all coming. Again, if something happens and we need to meet again,
okay,
I'll contact you, and it'll be a lot better because my administrative assistant was gone today. The city manager was out. His administrative assistant was gone. So you did well. Yeah,
that's right.
You did well.
Got more here, so assistant city manager got more.
Okay, assistant city manager, but his office on another floor. So you know what?
It's just like
man. So
we had to make venture because we suspect it's going to be okay.